Hi YouTube, it's Natasha. Today is February 14th, 2013. Happy Valentine's Day. I am making my 6-week tummy tuck update and then my 27-month VSG update. I had a tummy tuck with vertical incision on January 2nd. So I was 6 weeks out yesterday and I had my 6-week follow-up. I had my VSG November 2nd, 2010. I have lost about 130 pounds or so, maintaining between 120 and 130. Yeah, so that's going good. Nothing much really to say about the VSG, I guess. I just wanted to really quick give you a body shot and talk about my tummy tuck recovery a little bit because I haven't made a video in 3 weeks. So I had my appointment yesterday with Dr. Lytle. He said that things are going really well. My scars look really well. He said I'm an excellent healer. And he said right now the scars at 6 weeks, they generally look the worst that they're ever going to look. And mine don't look bad. My vertical incision has become noticeable, where at one time it was a really faint scar. And it's still very thin, but the pigmentation is darkened up. The horizontal scar across the front is smooth and it's fine. My hips are the only areas that bother me. I have an indentation on my left hip, which is scar adhesion. The scar is adhering to the underlying tissue, so I have to massage that every day. And he said if by 9 months out it's not better, then he'll have to go in and do a revision. The right side, no indentation. That scar, it's a little more raised than across the front, but it doesn't bother me. The only thing about that one, I don't really care for the shape of it. It's kind of a jagged scar. But he explained the reason why he had to go so low on my hips is because on the right side especially, I had a dog ear, and he was trying to prevent that. Because that was the main reason why I went vertical, is because I didn't want a dog ear. So that explains the right side. Let's see. The massages I have to do is just basically circular pressure on the scar. He told me to do it about 10 times a day for like a minute, 2 minutes. Today's the first day today's the second day, and I'm not good about remembering to do it. So I have to work on that. We talked about a breast lift. I'm definitely going to do a lift. I was debating whether or not to do a lift and implants because I've always had a larger chest, but I really think I'll be top heavy if I were to get implants. And I'm comfortable with the size that I am now. So I'm thinking I'm just going to do the lift. Dr. Lytle's preference actually is to do, if someone wants a lift and an augmentation, his preference is to do them separately because he says it's less trauma to the nipple and he doesn't want to cause loss of sensation or even a dead nipple. So from loss of blood supply. So I was given the quote of $6,200, $3,875 is surgical fees, $1,800 is for the operating room at the surgical center, and $725 is the anesthesiologist fees. So right now, if I were to put a deposit down, I could get it done in April. And I'm leaning towards doing that. I really am. I'm thinking by the end of the month, I'm definitely going to get it done. By the end of the month, I should have made a decision about exactly when I want it done. Do I want it done in April? Do I want to push it out a little further? So I think that's that with the doctor. As far as my scars go, I'll show you really quick. I'm going to zoom in a bit. And if you all remember my last body shot of my tummy tuck, I can't hold the camera straight. So I want to pull my pants down without showing you everything. Because I guess we don't know each other that well to show you everything. Okay. So, oh, and my band, I don't wear my compression garment anymore. I actually probably stopped wearing it like I was. I was wearing it 24 hours a day, every day, for probably the first 5 weeks. And then I got tired of not being able to wear dresses because it doesn't really look good under dresses. So probably last week, week 5, I didn't really wear the band at all. But when I come home, I put it on because it does feel better to have it on. The other thing that from my post-op, I just remembered, right in this area, at the top of the vertical scar, if you were to touch it, it's hard. This is where your muscles are tightened right up the center. So it's hard in here. I don't know how far down your muscle goes. Like, it's hard here, but it's a different kind of hard. But this is definitely muscle. And he said, you know, he probably could go in and take out a little bit more skin. But he was worried that my scar wouldn't be as nice. But it's hard here, and he said that's just the muscle sewn together. So I figure today it doesn't look that bad. Some days you can notice a bulge. But I said maybe that'll inspire me to work on a 6-pack so it'll bulge in all the right places. But nevertheless, this is my scar. Like I said, the vertical scar, very thin. Down here, it's not really noticeable at all. Here, it has darkened up. It was kind of pink, but because it's so thin, it wasn't really noticeable, and now it's darkened up. But even if it stayed like this doesn't bother me. The vertical scar, let me turn. This is the indentation from the adhesion. Let me zoom in. Excuse my fat butt, but that's the indentation where I have to massage every day. It actually, I did massage it a good amount since I've been home from work, and I massaged it pretty good yesterday. It doesn't seem like it's as deep as it was yesterday, but again, that could just be all in my head because I really want to think that I'm doing something. But as you can see, the scars, you know, from here on to the front doesn't look bad at all. It's very thin, and it's smooth. Oops, smooth all along the front. Then we get to the right side, and the right side is where, like I said, it's not a pretty scar. Like, to me, pretty would have been up above that. He might need to revise this side, but this side, there's no indentation. It's not tender at all. It's not hard. It's just, I probably could have stood to get some lipo and it would look a lot better. Like, if I pull that up, the scar is far smoother. So it is what it is. But, like, in my opinion, to have a flat stomach, to not have anything hanging down here, is a million times better, and it's worth it. And I could care less about a scar or an indentation in, you know, in the grand scheme of things. I'm good. I'm happy. My navel has the circle around it from where it was stitched. I'm getting used to my navel. I think it's a nice navel. What's strange to me is to look at it and to see this circle around it. But hopefully that'll fade. I might get some kind of scar cream. He told me I really don't need to put anything on my scars, that they look good and they're going to lighten up on their own. But I might do it, especially around my navel, because that makes it look kind of weird to me. But other than that, I like it. I can get my finger in there now where I couldn't before. But I don't think I'll do that because then it stretches out and it looks crazy. So yeah, that's that. The only other thing I wanted to tell you all about was, sorry, my camera went blurry. I actually went back to work early. I wanted to tell you all that. I went back to work at 3 weeks. So I guess the last time I made a video, I was 2 weeks out. I went back to work at 3 weeks because I was bored. My husband was at work. My kids were at school. I was bored all day. I really couldn't do anything. And I figured that I might as well go back to work, not fall off payroll, and then I wouldn't have to worry about not receiving a paycheck when I got back to work. So I did end up going back to work. I was actually maybe 2.5 weeks out. I went back with restrictions. I couldn't lift. And my job is half field work, half office work. So I wasn't going out in the field either. I actually just started going back out last week. But I'm glad that I did go back to work voluntarily, because when I got back, I found out that I had been denied FMLA. Apparently, I have exhausted all my FMLA time from my various medical leaves in the past, and the time had not accrued again. So had I stayed on leave and fallen off of payroll, I would have had to cover the full amount of my medical insurance, which I was not about to do. And if it was just me alone, I wouldn't worry about it. But my children are covered under me. My husband has his own policy from work, but I have the kids covered under me. So, you know, I really had no choice but to go back to work, even though probably for the first, up until this week, maybe up until the end of last week, I was walking hunched over. And everyone who saw me at work was like, "Are you supposed to be here?" And I said, "No, but I really don't have a choice. And you do what you have to do sometimes." So I went back to work early. My plan when I get my breast lift is he does this surgery at this particular surgical center I'm going to on Wednesday afternoon. So my plan is to get it done Wednesday, be off Wednesday, Thursday, Friday, have Saturday and Sunday to recover, and go back to work Monday. May have to go back to work doped up, may have to get dropped off and picked up, but I'm going back to work because I don't have the ability to take off and have health insurance. So that's the plan. So this video is far longer than I intended it to be, so I am done. Again, happy Valentine's Day. If I have any new developments about anything, I will get back with you. Take care, everybody. Bye.